Have you ever felt utterly drained, not just tired, but profoundly exhausted, wishing you could understand why your body simply won't cooperate? It is easy to confuse persistent fatigue with feelings of sadness or a general lack of motivation, leading many to wonder about the fundamental differences between physical and mental well-being. Myalgic encephalomyelitis, commonly known as chronic fatigue syndrome or ME/CFS, is a distinct, complex, and serious neuroimmune disease, not merely a form of depression. While depression can certainly coexist with ME/CFS and is a valid health challenge in its own right, the core mechanisms and primary symptoms of ME/CFS set it apart as a unique medical condition. The fundamental distinction lies in the underlying physiological dysfunction of ME/CFS, particularly the hallmark symptom known as post-exertional malaise, or PEM. This means that even minor physical or mental exertion can trigger a dramatic and prolonged worsening of symptoms, often delayed by 24 to 72 hours. This is not typically seen in depression, where physical activity often helps improve mood and energy levels. With ME/CFS, the body struggles to produce energy efficiently, affecting multiple systems including the immune, neurological, and metabolic functions. Patients frequently experience unrefreshing sleep, cognitive difficulties, often called brain fog, orthostatic intolerance, meaning issues with standing upright, and widespread pain. These are specific, measurable physiological problems that go beyond what is primarily observed in major depressive disorder. To understand these differences for yourself, it is crucial to pay close attention to your body's specific reactions and patterns. Keep a detailed symptom diary, noting not just how you feel, but also what activities you engaged in before symptoms worsened. For example, if a short walk or a focused mental task leads to a crash a day or two later, that points toward PEM, a key indicator of ME/CFS. Openly communicate these specific patterns and physical symptoms, along with any emotional changes, to your doctor. A thorough medical evaluation can help identify the root cause of your fatigue and guide you toward an accurate diagnosis. Recognizing the presence of post-exertional malaise is the critical step in differentiating ME/CFS, this unique reaction to exertion, alongside other specific physical symptoms such as chronic sore throat, tender lymph nodes, and profound unrefreshing sleep, points towards a systemic illness. Understanding these distinct characteristics is vital for both patients and healthcare providers, ensuring that the appropriate diagnostic criteria are applied and that care is tailored to the specific needs of someone with a complex neuroimmune condition. Ultimately, recognizing ME/CFS as a distinct neuroimmune illness is essential for accurate diagnosis and effective management, moving beyond the misconception that it is simply a psychological state. By understanding its unique physiological markers, particularly post-exertional malaise, individuals can receive validation for their experience and access care pathways specifically designed to address the challenges of this debilitating condition.